Friday and welcome. Thank you for showing up. It is good to see you. Hi, Gino. Good to see you. Fantastic. So, if you don't know who I am, my name is Alicia Vienga and I am the founder of After Breast Cancer. Honestly, guys, if you told me that at the start of 2020 that we will be in this position under lockdown, being isolated, that moms are tossed into becoming teachers and educators, people will be losing their businesses, I would tell you absolutely not. You must be crazy. That is so unreal. But today, here we are, and it is real, right? I think some of us are experiencing the same thing. Lots of people are hurting. We know that, definitely. Lots of people are hurting. They're dealing with issues that they have never dealt with before. And we need to be real. We need to have a conversation about mental health and breast cancer. And the fact is that isolation brings mental instability, right? A couple of weeks ago, I started a series of events called Real Conversation on Zoom. And then we also started our Stay Healthy For campaign to remind everyone to stay healthy for ourselves and for each other. And here we are today, and we are on Instagram Live with so many of you guys, and thank you. And we hope to make sure that this is on a regular basis, right? So in the meantime, please make sure you send us all of your questions and concerns, or who you would like to see on our Instagram Live in the future. You could do that to info@afterbreastcancer.ca. And for you guys, if you haven't participated in our Stay Healthy For campaign, do so. Go on our website, afterbreastcancer.ca, to participate. So today, we want to give a warm welcome to the Honorable Minister Michael Tibollo. Michael is a friend of After Breast Cancer, and he is the Associate Minister of Mental Health and Addiction. And I'm a big hugger, and I wish he was here and I would have given him a big hug, but moving forward, we don't even know if that is a possibility. I'm seeing all your paperwork on your desk, Minister.
Oh, okay. Am I? Oh, it's the front. Okay. How do I flip this now?
I thought I was really bad with technology, but you flip it like you're doing a selfie. Turn the camera around like you're doing a selfie. Yes.
There we go. Sorry about that. No, I've been I get up at 7 in the morning and I'm at my desk at 7 in the morning, and all I do is paperwork, read, and anyways, so it's a little messy.
Well, I could see a lot is happening, and I know, I just want everybody to know that you are real. You're a doer, you're a hard worker, you are passionate about mental health, about women's health. If I didn't say it before, you're extremely hardworking. And I am super grateful that you are joining us today on Instagram Live to talk about mental health and breast cancer. I know you are busy. I know there is a lot going on. So thank you for being here today. Gino is on the line as well too. So I guess he's going to send a little wave very soon.
All right. Now I'm trying to. Can you hear me? Okay.
I can hear you very well.
Perfect. You're very soft. Your voice is very soft. I can barely hear you, but I'm hoping you can hear me. And I just wanted to say hello to you and to everyone. And thank you for giving me the opportunity to speaking to you and to everyone that's assembled here today. My background, the work that I do is mental health and addictions. I'm the minister responsible for that in the province. And I'll try to keep my comments short because if there's people that have some questions, I'd love to answer them. We know statistically that 50% of the population in Canada is suffering from some form of anxiety right now or depression as a result of COVID. We also know that of the population in Canada, between 60 and 70% of the people suffering are women. So it's affecting women more than it does men. And from my standpoint, my understanding of it is that it affects women more than men because they're now the teachers, they're now the moms, they're now the partners, the spouses. They're having to deal with a lot more pressure and stress than they would normally deal with. Not that it's easy being a mom in normal times, but there's a lot more stress and pressure on everyone. Anxiety and depression comes from being isolated, but also comes from all the added burdens and everything that happens. We know, for instance, that we are creatures of habit. We have routines. All of us have routines in normal times, and when we have our routines broken, it causes anxiety, it causes depression because it creates the unknown and the inability to kind of plan your things going forward. So I've been telling people to, create itineraries, schedules for themselves to make sure that there is something to do and that the things are being done in a form of a routine. Make sure that, we talk about being physically isolated. We've used the word socially isolated, but we don't want to socially isolate. We want to physically maintain separation, but socially we should be talking to each other. We have more tools now than we've ever had in the history of mankind to be able to communicate. So we've got the telephone, we've got, email, fax, Instagram, Facebook, Zoom. There's so many different things that we can do. And we need to utilize those resources to our benefit now, especially in times when, we can't see our families, we can't see our parents if they're not living with us. So use those tools. Reach out to the seniors. I always say to people that it's important that if someone is living on their own, at random acts of kindness, pick up the phone, deliver a newspaper to them, a magazine, knock on the door, step back, ask them if they need some groceries. We need to do more of that kind of work in order to be able to feel that connection again. And, when we have people that have compromised immune systems, I mean, I'm 60 now, so my immune system is compromised just by being 60. Silvana, my wife, went through, a bout with breast cancer herself. And so she has a compromised immune system. And I know I'm very careful when I leave the house to want to make sure that I wash my hands before, touching anything in the house. I wear gloves, I wear a mask. And these are precautions that we both do because, when you are looking after yourself, you're really looking after a loved one, right? You're making sure that that person doesn't end up getting the pathogen and getting sick from it. So there's a lot of things we can do like that, Alicia, and thank you for letting me speak this afternoon.
You're welcome. Not a problem at all. So I know you touched on a lot of the questions that we had to ask you, but I want to know, let the audience know, let the people know who's here from Minister, what message do you bring to us from the Ontario government and to breast cancer and cancer patients, especially who have a lot of anxiety and from COVID-19? It's crazy. It's sorry, crazy may not be the right word. It is a stressful thing to go through. So what message can you give us from the Ontario government?
Well, the Ontario government has invested $12 million in emergency spending relating to mental health. And what that means is that we've opened and provided additional supports through Connects Ontario, through Kids Help Line, through some other help phone lines that are there to help the people in the province that are feeling depressed or that are feeling anxious. We've also invested money in something called internet-based cognitive behavioral therapy. So what you can do is through ontario.ca, you can source out a psychotherapist or an organization. There are two that are providing internet-based cognitive behavioral therapy, and you can utilize those systems to help you through a workbook method to help you build resiliency and coping skills in difficult times. We've also done the same by investing and creating supports for people that are frontline workers and that are, first responders, because again, they're doing an incredible job and they need to have those supports in place as well. So the government is very interested in making sure that people stay healthy, not only physically, but mentally as well. And I keep on telling people you can't have physical health without mental health. One of the things I remember with Silvana going through her own journey with the breast cancer, the times that she was going for treatment, the times that with when her hair was falling out, and all the different things she went through, that she needed to have those emotional supports, and she needed to have people know that she was important, that we cared about her, and those are the kinds of things that not everyone has the fortune of having people around them all the time to help like that, but we want to make sure that there are people that you can talk to. So that's the whole reason behind creating this reinforcing the network that we have for connecting people with services in the province.
Mm-hmm. And that is really important. It's going through breast cancer in this time or any illness. It's stressful. It's already stressful going through that and going through a true isolation. I've learned through the past couple of months that the women, to see the strength that these women have, right? The fact that they are, for years, if you are a breast cancer graduate, you are in somewhat isolation, but it is totally different. Now you are told that you have to stay. You're told that you have to be careful. So one of the things that I heard from some of the breast cancer graduates in the last couple of months is that their surgeries are being canceled, right? Their therapies are being canceled. So what are we doing about this right now?
Sorry, Alicia, I didn't hear that.
So my question to you is, for the last couple of months, I've been hearing from the breast cancer graduates, from women who are having their surgeries are being canceled, their therapy sessions are being canceled. What is it that the government is doing right now to help? And to help these women from being so anxious and the insecurity, the fear that they're feeling?
I'm really having a tough time. I don't know what's wrong with my phone, but I can't get. I think the question you asked was that there have been a lot of women that have not been able to get access to the services they needed during this time.
Yes.
With the pandemic. We are now, the thing is that the services were not completely shut down for people that were in need of emergency supports. What we did was we continued allowing for those, but what we were trying to do is ensure that there was a sufficient capacity in the system in the event that it was needed for COVID, because you need, certain medicines, you need certain PPE to be able to perform surgeries, and that you also need staff. And so the concern was that if everything went the wrong way and we needed to have capacity, that we didn't want to put anyone at risk during that time. But what we've done is we've started opening surgeries, and all the hospitals are starting to ramp up again by having the PPE equipment available and making sure that they have the appropriate staff in place. It was a very difficult time for sure. And I know that there are a lot of people that, again, it's impacted their mental health, knowing that they need to get to a hospital, they need the supports, and they weren't able to get them. So, but we're working to rapidly increase capacity again to make sure that all those services are available to everyone.
Suzanne is asking a question. I don't know if you could see it. It is so difficult when oncology appointments are by phone. It's certainly not the same. So I think there is a lot of anxiety there in itself. Are you hearing me still? Like, is your volume turned up?
Yeah, you know what? I don't know. Can you do anything from your side for the volume?
No, because I could hear you very well.
I don't know what's going on from my side here.
Turn up your phone volume.
I did. It's right to the maximum.
Oh, so
and
can you hear me now?
The same.
You know me. I don't speak soft. I speak very loud. Woo,
Yeah.
passionate. Woo. So I think it's on your side. I think the internet is a little bit. It's not the best as well.
How that happened, but it's working now. I gotta just switch it back so it comes to me again.
Yes,
there we go.
I'm seeing you.
I can actually hear you a lot better now.
Oh, fantastic!
I don't know what I touched.
I don't know.
So there's a message. I don't know what I touched, but you are louder now.
Oh, great!
So I'm looking. There's a question here. I have a friend that hasn't left home since March because she has a daughter that had respiratory issues when born 5 years ago. She's afraid. What advice do you have that I could share with her? The only thing that I can suggest is that if she's going to go out and she's coming back into the home, she should be wearing a mask. She should wear gloves. She should wash her hands frequently. I would also, and there's more and more evidence coming out about this, if she lives in a house and she has space to be able to take her daughter outside, I would do that. It's one of the things we're finding is that vitamin C and vitamin D are an important part of a person's ability to build immunity. So what I would do is I'd say, spend some time outside in an area that is clean and that there aren't other people. And those are that's the extent of what we can do. And when she goes outside, make sure that she's wearing PPE, not only her, but also her daughter. It's hard, but that's unfortunately the only thing we can do until we either build up what's called herd immunity or we have a vaccine. The one good thing, and I know when you talk about respiratory issues, even as a child, that's a compromised immune system, and there's a greater risk of it developing into something more. So the only thing we can do right now is take precautions to minimize the risks.
Yeah, absolutely, but it is still difficult. It is, unfortunately, this is the world that we are living in right now, and it's an adjustment that we all have to make. I have a question for you. We know that there is a stigma. Can you hear me now?
Perfect.
So we know that there's stigma behind mental health. Looking for help when it comes to mental health. What is it that you could say to someone who is struggling with mental health right now? And there's a lot of people. Coming from the Minister of Mental Health, what can you say to that person right now?
What I would say to them is very simple. If you fell and you broke your leg, or if you had a pain in your arm, the first thing you would do is you would go to the hospital to get it reset or to get it fixed. Mental health is no different. When you have a need to speak to someone, when you're feeling anxious or depressed, you go right away. You should be going right away to get help, because the earlier you intervene with a lot of these issues, the better the outcome will be. And I know that, you know, in the different cultures, I mean, in the Italian culture, to think that you have a son or a daughter that's having a mental health issue, the first thing you would say is suck it up. You know, there's nothing wrong with you. It's the wrong attitude to have as parents. What you should do is you should seek out that help. And I mentioned before the internet-based cognitive behavioral therapy. As part of the strategy that we've developed for the province, we also have cognitive behavioral therapy in the form of structured psychotherapy that's available through OHIP. We're the first province in Canada to have that put in place, and that it's an excellent program for mild to moderate depression and anxiety. Most people are okay when it comes to dealing with difficult situations. They just need a little bit of help. And the problem is that because of the stigma associated with mental health or looking for help, people don't get it, and it compounds, it aggravates, it gets worse. So what I'd like to say to everyone is you shouldn't feel ashamed. You shouldn't feel. I'm an Italian father with 3 kids, and I've told them that, sometimes there's things that I can't help them with because I'm a different generation, and maybe they should talk to someone. And I've told them to speak to a psychologist or psychiatrist or whoever they can, they feel they want to speak to. Again, not because I think they're weak, but because I think that talking to someone who understands the issues gives them strength. It gives them the ability to learn coping skills and become more resilient. And, again, we live in a very interesting city, a very interesting province where we have so many different cultures that see mental health as a weakness. And we have to get away from that. We have to show people that, there's nothing wrong with saying that you're not feeling good today, and finding ways to help those individuals, be able to handle difficult situations. I can only imagine going through breast cancer, or cancer in general, or any kind of limiting or disease or sickness, that if you don't have those supports in place, your body can never really heal, because it all starts with the mind. If the mind is strong, and we've seen this with tests and experiments that have been done, that people many times get better just by, feeling better, or their mind being strong and not needing medication to get better. So I think what we need to do is work harder as a government to bring these opportunities to people to help them become more resilient and be able to cope with difficult situations.
I'm with you there. Now, there is a question from Otto that is talking about it is really difficult to get appointments in person right now. Doctors are consultation by phone, which is not helpful. When you're going through stress, going through the COVID-19 and you've been isolated, I don't think having appointments by phone is the right thing to do. So what would you say to somebody like Otto who is thinking that this is not the right way to go? And I'm hoping that it is just a short-term solution and not a long-term one.
Yeah. So again, we're in we're in unprecedented times right now. The one thing that I can say for certain is that the helplines that we have established are all extremely busy. The Kids Helpline, the Connects Ontario, all of them are extremely busy with people calling in. They provide a connection to the different organizations that are providing virtual care. Now, is virtual care the best care? There's evidence that shows that internet-based cognitive behavioral therapy is just as effective as face-to-face therapy. But it doesn't work for everyone, and there are people that have more acute issues. So what we've done in the province is we've established a place where you can go, ontario.ca, or through Connects Ontario, and there you will fill out a self-assessment form. That self-assessment form ends up being reviewed by a psychologist. The psychologist then calls you back, and there's a conversation that takes place. There's a possibility that the person does not need to speak to anyone from that point forward, and there's exercises, workbooks, and different things that people work through. In other cases, there's a need for there to be someone for the person to speak to. So there's therapy that's delivered by phone. And then the more acute cases, there's the possibility of setting up appointments to go and see a psychologist, a nurse practitioner, someone trained to be able to provide those supports. Now, the system has been broken for a long time. Alicia, you know, I came to government exactly to work in the area of mental health and addictions because I knew the system was broken and people that needed help weren't able to get that help. So what I did was I came to government and I started advocating from the minute that I got here about trying to build a system that's connected, that provides supports for individuals, that doesn't have extended wait times, which is something that has been an historical problem in the province. And we developed a roadmap to wellness, which is a plan for mental health and addictions in the province of Ontario. I launched it 2 weeks before COVID came in, which didn't give me the opportunity to really bring it out and develop it the way I'd like to develop it. So we're in the process right now of improving or putting together the plan of how we're going to launch it in a much more open way than we were able to because of the COVID intervention. But I have to tell you, one of the things that's been extremely helpful for us during this period of time is how quickly all the stakeholders and organizations came together and created a network that is really working well virtually. And, you know, as any plan, whether it be our healthcare system, our judicial system, it needed to be transformed because a lot of things were being done in a very antiquated way. This opportunity with the COVID has given us a chance to figure out things to get more people access faster and also be able to identify the people that need the more acute care so that we can provide that acute care as quickly as possible instead of trying to get everyone in and trying to figure out after who's going to go where. We're setting up mechanisms now that are helping us with access points and are helping us with that fragmentation so that we don't lose people and we are able to provide them supports right from the beginning.
Yeah, those are great, and Arthur says true. Thank you for acknowledging that problem. But I could see there is another problem based on what you just talked about with regards to somebody when they make a phone go online. People may fall through the cracks. Is there a phone number that they could call if they are in need of some help mentally?
Yeah, there's a few different organizations that have, as we're talking, I'm going to pull them up on my screen, but we have, for instance, Bounce Back. These are all lines that are available. If you go to ontario.ca, it'll give a list of all the different organizations that are involved. But Bounce Back is one of them. Big White Wall, Connects Ontario, Kids Help Phone. We have another line for kids in high school or 15 and over. So there are a lot of virtual supports, as well as being able to subscribe to internet-based cognitive behavioral therapy. So we've established many places, points of contact, and the system that I've tried to work and create is one that's integrated. So it means that it basically has all the pieces connected to it, wraparound, and needs-based. So your needs would be very different than my needs. So the person that you're going to first make contact with, whether it be at Connects Ontario or one of the other helplines, will be able to provide you direction as to where to go in order to get the best supports. And that person will track with you through the system so that we don't have those gaps anymore where people can fall through, or, you know, that unfortunately in the past were a big problem for trying to get people or give them that continuous support so that they did get better.
Yeah, yeah. Well, I'm really happy to hear that some of those loopholes are being closed and people are able to get support in every possible way, whether it's on phone or going online and fill out the assessment. And the difference, there's a difference between anxiety and depression and mental health. Nadia was asking, how do you know or recognize what your needs are? I'm assuming there is ways that you could maybe suggest or help us to identify.
Yeah, and again, if someone is feeling anxious, the feelings, the emotions that you feel, how the body reacts to anxiety, depression, I think most people understand that. But to understand the acuity, the level of depression or anxiety, what you really need to do is you need to have a proper assessment done. And the assessment, there is a tool, like I said, on Ontario.ca that will send you to a link. That link will give you, if you want to call it a test, it's 10 questions. And you'll answer those questions, and it'll tell you that, it looks like you have this as an issue. Now, we've had it tested, and we've seen that if someone is extremely depressed and is answering questions in a way that would indicate that perhaps they're suicidal, then immediately someone connects with the person and has a conversation to determine whether that individual is suicidal, because if that person is, then someone will be sent to their home to help them. But in most cases, what we're hearing, it's mild to moderate type anxiety and depression. And, again, just being at home myself, 24 hours a day, you start to feel confined. You start to feel isolated, restricted in terms of what you can do. And even though I'm extremely busy, there are times that I would like to meet up with a friend and have a cup of coffee. I'd like to go and visit, my mother. I haven't seen my mother in 9 weeks. I see her on the screen the way I see you right now. My daughter graduated from university yesterday, and we did it virtually. Thank you. We did it virtually so that everybody was in their own homes. They all had a bottle of champagne delivered to them and a cup and cupcakes, I think is what she sent. And we did the cake cutting at our table. But, my mother's old, and my mother-in-law is old. And these are they're important dates in my kids' lives. So, I feel badly for my daughter. I feel badly for my mother and my mother-in-law because, again, they're only going to be on this planet for a certain time, and we lose the ability to see each other. So, I'm respecting the rules, because not for me, but I'm respecting them for everybody else. And that's the message that I want to send to everyone. If you're respecting the rules about staying socially isolated or physically isolated, you're doing it for your loved ones. Because at the end of the day, anyone who has a compromised immune system risks death.
Yeah.
So if you think it's, a joke, or you take it lightly and you want to go out and you want to, do things and participate and be out in the public, just remember that you're potentially bringing home coronavirus into the house. And if you do that and you bring it home, someone young is going to be able to withstand it. Someone older may not be able to withstand it. So are you prepared to run that risk? And I'm certainly not. And hopefully the loved ones of the people that are listening to us today also feel that way. It's an important message, because, the way we're going to get through this is by, killing it off until there's a vaccine. Social isolation is the only thing we know for sure that works.
Absolutely. And thank you for being so open with us, and congratulations to you and your family on the graduation. Now, time flies like crazy, as we know. We are heading into a long weekend. I thank everyone for joining us today. Let us end on a really positive note and happy note. How would you like to close off today?
Well, I'd like to first of all thank all the people watching and listening to us. One of the things that the Premier has said over and over again is that it's not us that's doing it as government, it's the people of the province that are being respectful of the laws and doing what's right, which is to maintain that physical distancing. My message is the numbers are going the right direction. We're slowly opening things up. Eventually, I'm going to be able to get a haircut. And it's coming, because I know there's a lot of women that are very upset at us because they can't get to a hairdresser, or I can't see, I haven't shaved for 2 months. So
it looks good on you.
Okay, So, there's a lot of things that we need to start doing. And you know what? There's a lot of great organizations as well. Like I really feel for for our community, because there's so many organizations, including yours, that does amazing work that rely on on funding from private donors. We haven't had an event in a long time that we could share a meal and raise some money for worthy causes. Those are the things that I'm worried about. But one of the good things is that we are resilient as people. We're doing a lot to get everyone healthy physically. Stay healthy mentally. It's really, really important. Don't be afraid to reach out, talk to your friends via social media whenever you can, because at the end of the day, we're going to get through this together. We're going to be stronger as a result of what we've learned. And I think next time round, if there is another time, another wave, we're going to be able to deal with it a lot differently, a lot better than how we did this time. Even though I think we did a decent job, we're working hard. And again, thank you to everybody that's watching and listening, that is doing everything, doing their part to make sure that we all stay safe and enjoy. It looks like it's going to be a fantastic weekend. Enjoy the weekend. And I think next week there'll be more good announcements from the province in terms of more things opening up.
Thank you so much, the Honorable Michael Tibollo. It is fantastic for you to be here with us and to teaching us and letting us know what is going on in the government, in your world, in your family world. Please give our love to your wife, and I can't wait to see her again. I can't wait for you to sit next to us at a table at a gala. It's definitely not going to be this year, but hopefully next year. Thank you so much.
Look forward to it. God bless you, and please stay safe.
God bless you too. Thank you. Bye.
Thank you. Bye-bye.
Wow. What a wonderful afternoon. And it went by so fast. Thank you so much, everyone, for joining us. Kevin, good to see you. Thank you for joining us. Olga, good to see you as well too. And it was a wonderful presentation, and I hope you guys learned. Don't forget to go to ontario.ca if you need some resources, if you need help. And let us all stay positive together and stay healthy for each other. And looking forward to all the good news that is coming out within the government. And again, send us an email at info@afterbreastcancer. Let us know what you want to hear, who do you want to hear from. If you are a presenter, if you know an oncologist and you want to hear from them, please send us an email at info@afterbreastcancer. Thank you so much, guys. Have a wonderful and safe weekend. See you next week, or see you soon. Bye. Thank you, Olga.